Hello, everyone. It is April 26th, and we are at our second Brown Bag Lecture Series, Research Workshop for Spring 2024. Thank you all for joining, and my gratitude and thanks to Dr. Emanuel Alcala for his time. I know he's busy, but the topic of his discussion is social determinants to health research and risk factors in the Central Valley. So please take over.
Yeah, thank you so much for having me and thank you for inviting me to do this. Could you let me share my screen, please?
Sure.
It's yeah, I have to preface this conversation with, the title of this talk is a little bit of a misnomer. I set out to cover several studies, and so I just thought, oh, broadly, I'll talk about social determinants. And it turns out, it's just not enough time. So what I'll do is do a deeper dive into one of the studies here that we're currently working on. And perfect. Okay, so I think that you see the slides, right?
Yes.
So, as mentioned before, my name is Dr. Emanuel Alcala. I'm the Assistant Director of the Central Valley Health Policy Institute. And today, I'll be talking a little bit about the CalEnviroScreen and what that is, a little bit of redlining, and the importance of that being that it really sets the background and context for the research question that I'm going to be talking about today. And then I'll present this work that we're doing currently and it's getting ready for publication, which is tentatively called The Effects of Environmental Degradation on Asthma Emergency Department Visits, which has major implications for the San Joaquin Valley. Then I'll share the methods, results, and the discussion. And then, finally, I'll kind of try to end with a little bit of a shameless plug for the data that we have here in-house for this with the Central Valley Health Policy Institute, with the intention to inspire collaboration and for you all to just kind of reach out to us and see how we can collaborate. So what is the CalEnviroScreen? So the CalEnviroScreen, it's a screening tool. It was developed by the Office of Environmental Health Hazard Assessment and the California Environmental Protection Agency. And this is a very important screening tool. What it is basically every census tract, and for those who don't know, a census tract is a geographical unit that's a little bit smaller than a zip code. Um, every census tract in the state of California has a CalEnviroScreen score, and the score is really generated from how much pollution is in the census tract and how much kind of like economic pressures the people face in this census tract or community. And this score has major implications for how dollars are spent in the state of California. So many of you probably know about the state's cap and trade program, which is basically a program where industry, particularly polluting industry, that pollute, our air, our water, and our land, they're taxed and a certain percentage of how much they pollute, and that money goes into like a bucket of dollars, and which is literally becomes billions of dollars, and those dollars get redistributed to different communities in the state of California. Particularly, they get redistributed to the top 15 percentile of these CalEnviroScreen scores. So there's a lot at stake for these CalEnviroScreen scores. So here's a illustration of what are the components or the indicators that go into creating this CalEnviroScreen score. There's kind of two large buckets, as I mentioned, the pollution burden score and the population characteristics score. Basically, the pollution burden is broken out into two different sections, one being exposures. So these are air pollutants and water pollutants and pesticides. And then the second one being environmental effects is what they call them. And these are things like cleanup sites. So these are like super fun sites where, for example, private or public companies have literally polluted the land or water in a certain area, and they're, allegedly or kind of supposedly cleaning up these sites, and so they're called Superfund sites. And really, all of these items here, so cleanup sites, groundwater threats, hazardous waste sites, so on and so forth. This is what I'll be referring to as environmental degradation sites. These are like just basically poor use of land where pollution has occurred and is, degrading the land. The second component of the CalEnviroScreen score are literally about the people, and so that this is broken out. The population characteristic score is broken out into sensitive populations, which is basically measures of health, including asthma, cardiovascular diseases, and low birth weight. And then also what's taken into account are socioeconomic factors. So this is like educational attainment. So these are things like the percent of people living in poverty in this community, the percent of people who have limited English proficiency. So this is linguistic isolation. And so, kind of the idea behind this slide is I think it conveys two important pieces of information. One is this is literally how the state is thinking about how to identify vulnerable populations in the state of California. They are conceptualizing the fact that all of these indicators, whether they be exposures or health outcomes or, environmental effects, they tend to accumulate in by place. This is one of the ways in which the state is thinking about vulnerable populations. And so that's one thing to take away from this slide. The second thing is you'll notice that race and ethnicity, the racial ethnic composition of communities is not taken into account here. It used to be. So this current version of the screening tool. It's in its fourth iteration. And previous iterations did take into account how many non-white individuals lived in a community. And then, for various reasons, including kind of like political reasons, this indicator has been taken out from the screening tool, and it's not being considered in how resources are being distributed in the state of California. So, this is kind of like foreshadowing the research question here. Is why is this indicator missing from the CalEnviroScreen score? So just kind of really generally, bird's eye view, the way that the CalEnviroScreen score is computed is like literally it's the average values of exposures of air pollutants, of cleanup sites. They get that average and then they multiply that by average values of the population characteristic score. And then that's how they generate this CalEnviroScreen score, this measure of vulnerability. It's probably no surprise to you that the San Joaquin Valley lights up red, indicating that the communities in the San Joaquin Valley score extremely high on this measure, right? In terms of land mass, the San Joaquin Valley, definitely has the largest percentage of communities that score in the highest 90 percentile of this score. So this tool has major implications for the San Joaquin Valley, to say the least. So the two research questions that I'll be talking about here today is environmental degradation associated to asthma-related emergency department visits? And then the second research question builds off of that first one, just kind of saying, if this is true, if environmental degradation sites are associated to asthma, is that relationship different in white communities compared to communities of color? Just a tidbit more of history here. This is a map of Fresno. What's important for you to know and why racial ethnic compositions of communities matter so much for health is that in the 1930s, there was a group called the Homeowners Loan Corporation, which surveyed the entire United States. They literally went from the East Coast to the West Coast, surveying each major metropolitan city in the United States, and they created these maps. This is the exact map that they created for Fresno. And basically, what they did is they graded each community in the city, where the green areas are A, this is this is the best type of community that this city has to offer, where literally the community is composed of white people. That's literally in their definitions. And it's, a place in which you want bank, no. So the Homeowners Loan Corporation, they were basically working for banks and institutions that invest dollars into these companies. And so they were informing banks on who they should give loans to or not. And so they graded these communities, and they would say, okay, in these green areas, the banks, you should, invest, you should give these people loans. They're going to pay you back. The B is still desirable. It's sort of new land, and there's favorable people in their eyes in these communities. And then in the C areas and the D areas, right, the red lined areas, these were communities that were largely at that time Chinese and African American communities, which were graded a C and D, which were this corporation was warning banks, do not invest in these people, do not give them loans. I mean, honestly, that's just what it is. And and this is important to the story that I'm trying to tell, because I do believe that this historical context is embedded within the research question that I'm talking about here today. So the methods that were used for this study was that, it's a cross-sectional ecological analysis at the census tract level. So the unit of analysis is the census tract. So we're talking about communities. We collected data from the Department of Healthcare Access and Information, which they collect all hospital and emergency department data. The data is from 2016 to 2018 because that's the data that overlaps with the measures in the CalEnviroScreen. We look at 16 California counties, 8 of them being the San Joaquin Valley counties and 8 being other comparison sites. And then we conducted a negative binomial regression for multivariate analysis. The outcome of interest, the thing that we're looking interested in, is the rate of asthma-related emergency department visits. And so just a little bit of a technical piece here, which is the actual count of events was aggregated for each census tract. And then we also used the total population in that census tract to create a rate, right? How many, the count as the numerator and the total population as the denominator. We created an index to measure racial ethnic segregation in each community, where the value of this measure goes from the range is from 0 to 1, where communities that are closer to 0 represent more white communities, and the communities that are closer to the value of 1 represent non-white communities or communities of color. And then we created a dummy indicator just to identify these census tracts are within the San Joaquin Valley and these census tracts are outside of the San Joaquin Valley, just because we know that people who live in the San Joaquin Valley are at greater risk for asthma. We created 3 composite scores by conducting a factor analysis. And so these are the 3 buckets that we kind of adjusted for. So the first one being environmental degradation, and this is literally composed of the mean values of the number of solid waste sites, the number of groundwater threats, and the number of cleanup sites in a community. We also created a composite score of air pollution. So this is literally the mean values too of particulate matter and ozone in the community. And then we also created a composite score of socioeconomic disadvantage. And so it's a cluster of, the level of poverty, unemployment, educational attainment, and housing burden in a community. I added the Cronbach's alpha there at the bottom, which is just an indication of internal consistency. And so zero 0.9 or 0.84 indicates really high reliability. And all that means is that these items, for example, in environmental degradation, the item of solid waste sites, groundwater threats, and cleanup sites, it means that they are consistent with each other, and they're probably measuring something very similar. And so it's okay, or yeah, it's okay to kind of create a one singular score from those 3 items. Okay, so now on to the fun stuff. So the results. What you see here is scatter plot of on the y-axis here you see the rate of asthma emergency department visits per 1,000 in the population, and that ranges from 0 to 45. And then on the x-axis, you see the measure of racial ethnic segregation. So every dot on this scatter plot represents a census tract or a community, a neighborhood, so to speak. And what I think you can clearly see here is that as racial ethnic segregation increases, so as the communities become higher in people of color, so too does the rate of asthma emergency department visits increases, right? And I think you could see that with this red dotted trend line here. So that's kind of the first indication that there's something going on. After multivariate, regression analysis, there is, this wasn't a question that, I set out to answer just because it's something that we kind of knew already. I just wanted to highlight this piece for this audience just to know that, just by living in the San Joaquin Valley, you're nearly at 2 times the risk for an asthma emergency department visit than living outside of the San Joaquin Valley. Okay. So these two figures here start to answer the research question. So the first figure on the left with the blue bars, that shows on the y-axis the asthma emergency department visits. And then along the x-axis, it shows low, middle, and high environmental degradation communities. And what we find is that the communities that have the highest levels of environmental degradation have significantly higher asthma emergency department visits compared to the communities with the lowest environmental degradation sites, right? So that comparison is that communities with high environmental degradation are 1.26 times more likely to have an asthma emergency department visits than people who live in the low environmental degradation communities. The figure on the right with the gray bars shows a similar thing. It shows the rates of asthma on the y-axis. And then along the x-axis, you see racial ethnic segregation. And so what I did is I just, created tertiles. I created low segregation, mid segregation, and high segregation communities. And what you'll see is that this relationship is a lot more linear in that when you compare the low segregation communities, so these are white communities, compared to like kind of mid-level segregation, you see a significant difference, a significant increase in asthma emergency department visits. Furthermore, when we compare those white communities, that reference group, to the highest segregated communities with the highest rates of people of color, we see that the asthma rate increases even higher to 1.57. And these are the results from our regressions, right? So at the bottom, just highlighting the fact that we're adjusting for other risk factors. This is a little bit more of a complicated thing to communicate via this medium. However, this is the answer, or yeah, to the second research question, which was that, okay, if environmental degradation is associated to asthma, does that relationship change in white communities compared to non-white communities or communities of color? And so what I tried to do here is just to highlight in these blue lines the slopes of the relationships that are happening in different communities. So across the bottom in the x-axis, you'll see that the first set of 3 bars are white communities. They're low segregation, and then mid segregation, and then high levels of segregation, right? And then each colored bar are different levels of environmental degradation. So if we take that first group of 3 to the left, you'll see that in white communities, in communities of low segregation, we see that the effect of environmental degradation is almost nothing. It's null. In fact, it kind of trends downward, where as environmental degradation increases, it doesn't really change asthma visits. When you contrast that to the three bars furthest to the right, to the communities of color, to the highest segregation communities, we see that as environmental degradation increases, there's a very clear positive slope of asthma visits increasing. And that so indicating that the relationship between environmental degradation and asthma is different in communities of color compared to white communities. So just to kind of sum up what I think this study contributes to the literature is these three main key points. One being that we did find that environmental degradation is positively associated to asthma emergency department visits. Two, we found that racial ethnic segregation of communities is also positively associated with asthma emergency department visits, indicating that higher levels of racial ethnic segregation are associated with higher levels of asthma. And then finally, the third point being that the relationship between environmental degradation and asthma is different in white communities than it is in communities of color, where environmental degradation is more impactful to asthma emergency department visits. So just to kind of compare and contrast to other research that's out there, there is a plethora of studies that support these findings. There's a study showing that American Indians and Alaska Natives, when living closer to environmental degradation sites, tend to show higher levels of chronic conditions, including asthma and cardiovascular disease. There's also longitudinal studies done in Southern California showing that Latinos have differential impacts of air pollution compared to their white counterparts. And then there are studies showing that Black and African American persons living in the United States tend to live closer to Superfund sites than do their white counterparts. There's also evidence to the contrary of what I've found here. So the Hispanic paradox, particularly, I'm thinking of a study done in Chicago by Cagney that showed they did a very similar thing looking at place-based communities, associations between air pollution and asthma. And what they found is that the Latino population in Chicago showed lower rates of ever being diagnosed with asthma than their white counterparts. And just to acknowledge some limitations of the study, causality cannot be inferred from this study because these data are not longitudinal. Obviously you need that time component. We cannot determine how long an individual has resided in a census tract, so people move from place to place, and also even just adults tend to not work in the same community where they live, so the exposure to the environmental degradation site might be different than what we're attributing to that person. And then finally, that we're acknowledging that there's individual level risk factors to asthma, clearly like smoking or biological predispositions, which we cannot adjust for in this current study. So conducting a multi-level model to kind of differentiate community level effects from individual level effects is the next step. And I just wanted to highlight, here at the Central Valley Health Policy Institute, we have several different databases, and we're very eager to collaborate with on-campus faculty, across these different data files. We've successfully collaborated with a few. And so the types of files that we have here are, we have birth files, death files, and we also, for the state of California, and then we also have emergency department visits and patient discharge data, which is basically like hospitalizations. Yeah, so, please, if you have any questions or comments, please feel free to reach out to me, and thank you so much for your time.
Well, thank you so much, Emmanuel. I would like to open it for questions. So please feel free to unmute and ask questions. Well, it was very helpful, Emmanuel. Especially, I think I would be interested in the emergency, I would say, hospitalization. I work with seniors, and with my current work in health technology, I think I would be very interested to collaborate and see, especially in seniors, what's the fall risk, how we can prevent that, and how we can reduce the emergency department visits. So yeah, so this is open for the audience.
Should I stop sharing my screen?
Yeah, please do so. Thank you.
Comments, questions?
Hi. I just want to say it's very interesting. Thank you, Emmanuel. I really, it was great research, and it's very interesting to hear more about the work you do and the effects of some of these, things on our, Central Valley and on the people. What's like the next step that you do? Like, what do you do with the data once you gather it all, and how do you use it to create change or create the,
Yeah, I think, yeah, that's a great question. And, I would like to say that we have like two avenues or in terms of next steps. So one is, try to publish this and try to reach academic audiences because there's a lot of work, I believe, a lot of work to be done in terms of learning about how racism at the neighborhood level or is impacting health. I do think that there's more progress to be made there. And then also, as you probably know pretty well, Talia, is that here at CVHPI we work with community-based organizations, and so one of the things would be to work with like the graduate students that are on this call to develop a policy brief, to develop a short, digestible form for community-based organizations to have this information in hand to advocate for their communities to maybe it's to say I don't want this cleanup site in my backyard anymore,
Mhm.
or whatever it is that's a priority.
Okay, thank you.
Okay, if we have no more questions, then we are right on time to finish. Thank you so much for coming for the Brown Bag Lecture Series. I want to put a plug for our next Brown Bag, which is coming on Monday. This is on my talk, which is on virtual reality integration and curriculum, and especially looking into immersive virtual reality and its effects and what we can do in higher education with that. So thank you so much and happy Friday. Bye-bye.
Thank you all for the support. Take care.